So this is David. He's had this for a couple of months, and if you'll notice there's a swelling right in the top of his scalp. I chose to do an incision right beside it just because when it's so superficial that if you incise right over top of it, you'll rupture the capsule again. So the incision's been made here, and again we're using blunt dissection. So if you remember from the previous post, we're looking for that pearlescent material, which is right there. You can see it there now. It may still rupture, but you can see if we'd gone right over top of it, we would have opened it up right from the beginning because it's too superficial otherwise. So we'll see with this whether I can get around it. If we're lucky, then it'll pop out. If not, then it'll rupture for us, and then we'll have to take it out otherwise. Just see as it's coming out that we're able to lift it right out. Just like that. And there you can see the entire cyst is removed, so the whole capsule is gone. And so this will heal nicely for him, and then we'll just suture that closed and he should be done. And we didn't rupture the capsule. So now I'll suture him closed.